because Health Minister Dr. Amadou Lamin Samate on Saturday announced the confirmation of 5 new cases of coronavirus, bringing the number of active cases to 6 following latest set of 76 laboratory test results. For the first time since the confirmation of COVID-19 in the country, trace of local transmission of the virus has been confirmed on 2 cases. Dr. Samate said that 5 of the test results were positive, 1 was conclusive, and 70 were negative. He said 2 of the confirmed cases were on quarantine and later on home isolation on recent travel from the United Arab Emirates. 1 other confirmed case was in quarantine and later on home isolation on count of recent travel from the United Kingdom, and the remaining 2 confirmed cases are still on quarantine for being close contacts of the 4 confirmed cases. The inclusive case also has a recent travel history from the United Arab Emirates. He said that 2 of the 6 active cases were as a result of local transmission of the virus. Out of a total number of 9 confirmed cases in the country since the 17th of March, 6 are now receiving treatment, 2 were discharged after full recovery, and 1 dead. So that is the situation of the coronavirus in the country. As you heard there, of course, the minister confirmed that, there were 5 new cases in the country. And of course, our team is out and about, and we would now link to them. They are at the medical research center. And before that, though, we'll just do this because it has been suggested that the latest set of confirmed coronavirus cases in the Gambia include 2 female security chiefs who completed their 14-day quarantine period. Now, on the line at the Kotu Central Medical Stores is Ibrahim Abba to domesticate this subject. Well, good morning, Ibrahim. Thank you very much again for having you this morning on the line. Now, what is wrong with the quarantine of the female chiefs?
So the period for quarantine is 14 days in the Gambia here, according to the health ministry prescription, and the latest number of cases communicated to the country by the health minister over the weekend includes female service chiefs, like you mentioned, who were on a peace mission from the United Arab Emirates. You could recall on our 20th March coverage at the airport, this female contingent came back to the country barely 2 days after Gambia confirmed the first coronavirus case in the country, and the army was there to receive them, and the police, because it includes men from or women from the army, the immigration and the police, but they were not allowed to receive them because at that time the Ministry of Health has also put in place measures to make sure that whoever is coming from COVID-19 hotspot must be quarantined. So they completed the quarantine period and they were discharged. All of a sudden, that news came up that 2 at least from the contingent is confirmed positive for the COVID-19. We understand also 1 case is inconclusive now, but they actually completed the quarantine period with the Ministry of Health.
Yes. Now we know that the army was prepared to handle the quarantine of these cases, of these soldiers and police rather. Now, what went wrong?
Yeah, on the 28th March, when this contingent was coming back, the army, the police, the immigration were at the airport to receive them. Because we reported earlier that the army or the security has well-established health facilities where they could have taken these people for their self-quarantine on their own initiative. But the Ministry of Health at that time wouldn't take any chance because they had already issued the measure to say that whoever is to come, borders were shut already, so whoever is to come to join this country here will have to be quarantined. And that was a measure that the ministry wouldn't compromise on. So we saw military officials there who could not even have close range communication with these people who were returning. Family members of these female, officers also were at the airport on that very day, but none of them was allowed to come closer. Even journalists, we couldn't have access to interview them. But the Army PRO informed us that yes, although they were very ready to receive these soldiers, some of the, for their side, but the Ministry of Health at that time wouldn't take any chance. And now the question is, we know 6 April, the deputy CDS, actually paid homage or paid respect to these, the 14 female soldiers we know that who completed the quarantine to definitely go home to their various, locations. So now 3 of them are in this situation because 2 are already confirmed positive. We cannot ascertain. At this moment, we cannot ascertain how many soldiers or how many police, but 2 are positive of this female contingent who were in the UAE for a peace mission, official mission for the country. And 1 case is inconclusive, and that one has to be subjected to another test to confirm whether she also need to join these people to treatment centers under the government or actually be confirmed, negative to then go home.
Well, now that we are at this point, what are the health workers saying?
Yeah, health workers are, as always, are ready to talk to the journalists. They give regular press updates. Here at the medical store, we will be talking to Director of Health Promotion and Education, who is Modu Njai. He is with us, and he can now explain to us some of the procedures taking to get these confirmations announced before the press. Njai, welcome.
Thank you very much, and thank you for coming here. We are happy to have you, always happy to have iTV Africa, iAfrica TV. Basically, what we are saying here is we are strengthening our efforts in the area of surveillance, in the area of contact tracing, and also we're also urging the public to still use the 1025 to give us information. And if you look at 2 of the cases, we got it through a tip of the 1025, and I think they were being quarantined, and as a result of one of them was positive, and then all the immediate family members also those are the contacts. They were also traced and then identified and tested, and 2 of them are positive. So you can see how important we are trying to strengthen our 1025 call center, and also we are also strengthening our collaboration with other Senegal, like Senegal. We are also strengthening our cross-border initiative, and currently the IOM, International Organization for Migration, is working with the Minister of Health, the various regional health teams to engage communities at the borderlines, and these are the borderline communities we are doing, and I think this is something that will also help us to strengthen our efforts at the border communities.
So we know these female soldiers were subjected to quarantine. Do we establish as to their identity because it was consisted of soldiers, police, and then immigration? Is that established?
As far as I'm concerned, I got the names, and I think basically I wouldn't know whether they are immigration or police or soldiers. But as far as I know, these are people who are on quarantine, and then they've been tested, and then they've been, after their quarantine period, they've been allowed to go home. And then before they go home, their samples were collected. And normally when we allow you to go, and then they collect samples, they have to now test these samples. And then whilst you're at home, and if sample turns to be positive, then they have to go for you. And that is exactly perhaps that are some.
Would you also say that this procedure have chances of serious lapses, that somebody who is yet to be confirmed, the situation is yet to be determined, is allowed to reunite with the public?
In fact, we have also realized that what we are now doing is we are now thinking of, because we need to have a technical meeting on this, and during our ad hoc meetings, we had a brainstorm on this, that we need to increase the quarantine period to 21 days. That is just a suggestion from some of the technical, but technically we have to sit down and agree as to whether the quarantine, because we have to learn from these experts in the laboratory. And then the experts in the laboratory have, if they give us that advice that there's a need for us to, increase in quarantine period, automatically we have to go by that.
What is the official or medical period for quarantine that will definitely sort out all these situations of coronavirus?
Actually, as you know, corona is a new disease. That's why they call it novel corona. Novel means new, and then not much is known about it. So we keep on moving back and forth. Why? Because we try one strategy. If it doesn't work, you move back and then try another strategy. And that's what we are doing. Our quarantine period in public health regulation is 14 days, but depending on the disease. And now that we have, it's also trying to change, its form. So therefore, we also need to look back and see whether there is a need for us to increase the quarantine period. And that's what we are right now. And likely we might increase the number of quarantine period from 14 days to 20. But that is also not confirmed yet. It depends on technical review and technical, when we agree on it on a technical basis.
Looking at the complexity of the coronavirus, it is being novel. Is it safe to definitely integrate with all those people who have been discharged of the quarantine period?
I mean, for those who have been discharged of the quarantine period for at least 1 week, yeah, it is safe, depending on also when they don't manifest any of the signs. Like, for example, perhaps those people who, when they were being released, maybe they might either have produced one of the signs which is not detected. But now that we want to increase the period to 21 days, because the disease also may change its form, and so therefore, when we do that, perhaps we can also be able to check them thoroughly. And I think if we are able to come to with that conclusion, I think that will be the best thing. But we are here to agree on that.
So why are all those in quarantine not tested for confirmation on the day 1 or the 14th day before they are discharged?
Normally, tests are done, and it could be first test, second test, and just to see, followed by, daily assessment and trying to check their temperatures and so on. That is also done. But normally, as I said, if the samples are collected, for example, and then, for example, the last day or the second, 2 days before you release, automatically what we do, we just do the analysis. Perhaps the analysis, it may be at a point where you have so many samples to collect. So that may also delay, like if the sample is collected and other samples are there, maybe 50 samples are there, then they have to go by. As the samples come in, they test them as they come in. So therefore, perhaps that is why maybe there could be that delay in terms of getting back to them. But we'll improve on that.
Just quickly, can the Gambia afford to test every individual held in quarantine centers?
Yes, anybody on quarantine centers, we can afford to test it because we have the materials, we have the test kits, we have the personnel who can do it. And as I speak to you now, our laboratory at the National Public Health Laboratory will soon be operational in doing the test for COVID-19. Yeah, thank you.
That was a Director Mamadou Njai, Health Promotion and Education here at the Central Medical Store in Kotu, giving us more as to the way people were tested and how comes some people completed quarantine after all of a sudden we are tested positive. So these are the Amadou, the serious situations that the country is undergoing right now. But the ministry continues to give updates on daily basis, and then in the evening we hope that today's update also will be on time.
Yeah, interestingly, of course, listening to the director there to clarifying some of the issues or responding to issues there. But of course, now we are having people testing positive again, as you just mentioned, after completing quarantine. I mean, does this suggest that some weaknesses in the health sector?
Yeah, this is the question, because we are dealing with the public now. The public to hold their own opinions. No one controls that. So having known that these people were already discharged, and then after which they were confirmed positive now, the worry is whether the public will understand this, whether the discrimination will not be on all those who have undergone quarantine. So these are the questions. And then already these also people who might have gone back to their homes must have interacted with people. So the contact tracing is now going to be more of a challenge on the ministry. But this is a ministry that always communicates to the press to say that they are prepared. So now it is a matter of time for us to verify, for anyone to see whether what is being promised is acted upon.
Ibrahim, we got to leave it at that. Thank you very much for your time and, for abreasting us with the latest information about the, coronavirus situation. Thank you very much.
You're welcome, Hamad.
Thank you. There's a very own Ibrahim Presba, Senior Editor and Correspondent of Africa. They are speaking to us live from the Center Medical Stores in Kotu. Of course, you heard from the Director of Health and Communication, Mr. Modun Jai. They are clarifying some of the issues. Su ko defee rek ñu dellu si Julde ak Monia su ko defee dégg ngeen li nga xamante ne mooy tolluwaay coronavirus ci réew mi demoon nañ ba ñu foog ne affaire yi moom mu ngi gën a wàññeeku na daal ba ñu bari seen xel gën a dal waaye ñu jékki-jékki rek gisaat juróomi cases ci weekend bi mooy samedi ndax nga gën déggee xibaar boobu moon ñaa
waaw xibaar bu doy waar la Amadou bi ñu ko déggee te yëngataat na réew mi tam gën na tax tam nit ñi bàyyi seen xel xam naa ne right now moom ñi doon wéer yi dinañ gën a bàyyi seen xel tam waaw so moo tax li ñuy def rek mooy gën a nit ñi gën a bàyyi war seen xel te xam ne feebar bi dafa sérieux Gambie foo leen amul ñi dem ba mu des benn ñi doon dundee yaakaar so loolu taxoon na sax bi government tëjee market si ñu bari dañ si doon wane ne xam nga waruñ benn leen am te benn boobu sax óorul waaw soo léegi nag bi ñu gisee juróom yi nga xam ne buur na rek ñëw loolu doy na tiitaange te soo bàyyi xel sa dëkk bi tiit neen si bu baax a baax parce que dañ foogoon ne ndax si foofu la moo yem si foo yooyu parce que am na ku wéroon dem am na ku yàlla jëloon ba kanam waaye bu ñu gisee yeneen juróom ñëwaat dafa doy waar trop te yooyu daanaka mun nga wax ne si benn report la buuree rek ñëw moo tax tiital na askan bi te nekkuñ doon di xaar loolu soo kon la ñuy def mooy askan bi war nañ fagaruwaat dégg nga bàyyiwaat suñu xel toppiwaat digle bu nga xam ne li fi def na ko parce que li nga xam ne moo ko gën a indi ñi gën a moytu loolu lu si gën a bëri mooy saafuwante bi ak gën a dem si mboole yi loolu moo gën a dajaloo gi
I know Julde xam naa ne yaa ngi woon ci liif waaye obviously xam naa yaa ngi doon bàyyi xel situation coronavirus bi ay mbiram tamit update bi ak yooyu comme moon ñam ni nga ko waxee demoon nañ ba ñu jàpp ne benn moo des ñu bari commencé di relax si measures yu ñu teg ak yooyu waaye ñu eventually ñu déggaat 5 new cases lan nga ñu mën a indil ci loolu te tamit nuñ ko indee la ñeneen ñi nga xamante demoon nañ bi ñu test leen ñu dem def quarantine ba ñu ñibbi ñu jékki-jékki rek beside symptômes si seen yaram bi ñu ñëw ñu confirm ne dañ ko am.
waaw man daal lu ma wax moo nekk am na lu ñuul si soow mi and this is very scary and serious because and it's a serious lab on the side of the health sector because coronavirus ñu yëpp xam nañ ne dafa deadly it's very very deadly so balaa nga release nit ki make sure ne nga exhaust all tests nga make sure ne nga xam ne okay whether the person is really safe because right now lu gën a scary si affaire yi time boobu noonu su nit amee coronavirus dañ dee wax ne si biti la ñëw mu ñëw si dëkk bi mu am loolu noonu ñu confirm ne dafa positive but now su dee ne like dafa am situation boo xam ne dafa nekk internally then there is a problem considering our geographical location ak Gambia bi lu mel our markets and everything so demee fii Tabokoto market fii di nga realize Costa Road market rather di nga realize na the situation there is very serious nit ñi dañoo dajaloo foofu noonu dajaloo boo xam ne is very scary da ngaa wax ne okay ñii is it they are not aware that coronavirus is in the country or dañ nekk loo xam ne like they are not scared of the situation because most of the time soo waxee ak nit ñi dañoo coronavirus nekkut fi or others would tell you amut sax despite all the sensitization that is going on, all the deadly issues that are going on, all the deaths, ñoo xam ne ñu ngi am around the world, but Gambian bi dina la wax ne coronavirus is either amut or loolu noonu, people still have that mentality because even yesterday I was speaking to some people and they were telling me that, coronavirus amut fi. And I was surprised that, with all this announcement and all the sensitization that is going on, still now people believe that it's not happening here.
Absolutely.
So I think that for health sector, we want to improve a lot on that. And the new increase the quarantine period of these patients because exactly 14 days I think it's not really enough pour nga test nit ki because ñene yi they are fast pour nga gis symptoms others na daf they really hide.
All right.